Okay. Hi everyone. Today we can look at dry eye syndrome. This is a very common eye condition which is non-infectious. So we just want to look at it in terms of what exactly is the dry eye syndrome, how does it present, and as well as the management of this particular condition. But before we go into details of the dry eye syndrome, it is actually important to understand the production and drainage of tears. So we have to look at the production of tears, is one. How is it produced and what is its drainage system? Because the dry eye syndrome has a very close relationship with tears. So what is tears? It is just a clear watery fluid, and it is secreted by lacrimal gland and accessory lacrimal tissues. So there are this gland here, the lacrimal gland, produces a layer of tears which we call aqueous layer. It's important to know, even before we get there, it's important to know that tears itself, this clear watery fluid, has three layers, of which the first layer is the lipid layer. Then the middle layer is known as the aqueous layer. And then we have the mucin layer. So the clear watery fluid that we refer to as tears, which is found on the surface of the eye, has got three layers. This is 1, 2, 3. So this layer lipid is normally produced by meibomian gland. The aqueous layer is usually produced by lacrimal gland, while the mucin layer is usually produced by goblet cells. So as you see, the tear itself, we call it tear film because it has these three layers. And this layer, the lipid layer, when you look at the arrangement of the tear film, something like this, so we have the outermost layer, which is the lipid layer, then the middle layer, which is the aqueous layer, and then we have the mucin layer. So this one ensures that it regulates the rate of evaporation of the tears. So it's the one that ensures that tears doesn't evaporate faster. We shall see as we progress. Then the aqueous layer plays a role in terms of lubrication, protection, and nourishment of the eye. The mucin layer is the layer that anchors the entire tear film actually on the surface of the eye. On the surface of the eye, we have some projections, microvilli. So it is on this projection on which the entire tear film is anchored. So we are saying the tears is just a clear watery fluid, and it's secreted by the lacrimal gland. The reason why the lacrimal gland takes the first recognition here is because it produces the aqueous layer, which is about 90%, which forms about 90% of the entire tear film. And these other two produce very little. This one is about 1%, this one is about 10%. There are always the ranges. But the aqueous humor, the aqueous layer, which is produced by lacrimal gland, takes the largest percentage, which is about 90%. And then we have types of tears. But before we talk of the types of tears, it's important to remind yourself that the functions of the tears is to lubricate the eye. It also protects the eye and nourishes the eye. So, in terms of lubrication, if you have your eye here, assuming this is your eye, and it's just something like this. This is your upper eyelid. This is the upper eyelid. And then this one here. This is the lower. This is the lower eyelid. So, tears is found on the surface of this eye. And when you blink, as the upper and the lower eyelid, this one here and this one, as they close and open, tears enhances lubrication. That is why we say one of the functions of the tears is lubrication. Then it also serves the functions of protection. How? The tears itself has antimicrobial proteins. A good example is IgA. This is immunoglobulin A, which is an antibody that is found in tears. So, apart from this, we also have other enzymes which are antimicrobial, and they function to offer protection on the surface of the eye. And then another function is nourishment. A good example when we talk of nourishment is the issue to do with provision of oxygen to the eye. When we look at the eye, the anterior surface, the part we call the cornea, is avascular. It doesn't have blood vessels. So the tears on the surface of the eye absorb oxygen, which is now delivered to the cornea directly and nourishing the cornea in terms of provision of oxygen, among other processes. The tears can also serve as an optical, it can form part of the optical benefits to the eye, because being the first substance on top of the eye, it is also part of the optical. optical benefits of the eye. So it provides refraction of the light, as in the process in which light has to pass through the eye and all the way to the retina for you to be able to see. So the first substance that is found on the surface of the eye is actually the tears. Now we have the types of tears here. We have three types of tears. The tears that is produced continuously in the normal life, in the normal daily activities to lubricate the eye is called the basal tears. So this one is produced continuously to keep the eye moist. And it's normally mostly produced by accessory glands here, accessory glands. So the accessory glands, in this case, we have two of them. We have Krauss, and then we have Wolfram. These two are examples of accessory glands which produce basal tears. And this one, the Krauss glands, are found in the fornix of the conjunctiva. While the Wolfram, this one here, is found on the edges of the tarsal plate of the eyelid. When we talk of the fornix of the conjunctiva, it means the conjunctiva anatomically, it has actually three parts. When you have your eye here, for example, and this is the lower lid, this is the lower eyelid, this is the lower eyelid, this is the upper eyelid. So the conjunctiva is the tissue that aligns the upper eyelid and then comes on the surface of the eye. The same thing down here. It aligns the lower eyelid and then comes to the surface of the eye. So the part of the conjunctiva that holds on the lid is called palpebral conjunctiva. Palpebral conjunctiva. While this bit of the conjunctiva that is bending here is what we call the fornix of the conjunctiva. This one here. And then the bit that lies on the eye is the bulbar conjunctiva. So conjunctiva has three parts. So in the fornix here is where we have our accessory lacrimal glands known as the Krauss. So Krauss and Wolfram are the accessory glands which produce the basal tears. Then we have the reflex tears. This one comes about when there is an irritation in the eye. For example, when your eye is dry, the cornea, the surface of the eye will be irritated, and then the type of tears which it will produce is known as the reflex tears. Sometimes the onion. This one is a very common phenomenon. When you peel off an onion and the substances of the onion, if they diffuse into your eye will be irritated and then will produce the type of tears known as reflex. That is in response of an irritation on the surface of the eye. Then we have the third type of tears, what we call emotional tears. This one is triggered when an individual has strong emotions. For example, if you have lost your loved one, or sometimes when you are emotionally affected, then the type of tears you will produce is known as emotional tears. So this is the eye structure. This is the eye structure. External surfaces plus the accessory structures of the eye. So this is the lacrimal gland here. What you are seeing here is the lacrimal gland. Lacrimal gland. So it is this gland that produces the layer of tears that we call the aqueous layer. And this aqueous layer forms about 90% of the entire tear film. Then between the lacrimal gland and the eye, you can see we have these projections here, which are connecting the lacrimal gland and the eye. So these are what we call the lacrimal ducts. What is their function? Their function is to allow trickling of tears from the lacrimal gland into the eye. So your tears will be produced in the lacrimal gland, then it will trickle into the eye through these openings here. We shall see as we progress. So once the tears get onto the surface of the eye, you will blink. And then the moment you blink, tears will now move from this direction towards this direction here. At this point here, tears will accumulate there. And that is what we call the lacrimal leg. This point here is normally referred to as the lacrimal leg. So your tears is produced here. It trickles through the lacrimal ducts onto the surface of the eye. Then you blink. Then the force that results from blinking pushes your tears from the lateral side, this is the lateral side, towards the medial side. Then from there, when you look carefully here on this diagram, you will realize that there is an opening here and an opening here. So those openings are what we refer to as punctum. 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 So the upper one is known as the superior punctum, superior. While the lower one is known as the inferior punctum, inferior punctum. So as the tears accumulate here, it will get into the superior and inferior punctum, and then it will get into these ducts here, these channels here. We call them canalicula. Canalicula. So we have the superior canaliculi and the inferior canaliculi. Inferior. So once your tears gets into the superior and inferior canaliculi, it will get into the lacrimal sac. From the lacrimal sac, it will trickle down into the nasolacrimal duct until it gets into the floor of the nose. That is what we refer to as the inferior meatus. Inferior meatus. Inferior meatus. So, as you have said, your lacrimal gland will produce tears here. It will trickle onto the surface of the eye through these lacrimal ducts. Then you will blink. The closing of the upper and lower eyelid will push your tears to the lacrimal leg. From there, it will get into the superior and inferior punctum via the lacrimal canaliculi, these ones here, into the lacrimal sac, into the lacrimal duct, down there up to the inferior meatus, which is found in the nasal cavity. So this is a representation of the tear film, showing the layers that we have already talked about. So when you look at this diagram clearly, the pink structure you see here is the cornea, just a portion of the cornea, and that cornea has microvilli. So it is this microvilli upon which the tear film is anchored. And the innermost layer is the mucil layer. This is the layer that actually is in direct contact with the microvilli. And at the middle, what you see in blue is the aqueous layer. The aqueous layer. You can see it's a big portion. We said it accounts for about 90% of the total tear film. And then the outermost layer is the lipid layer. This one is about they are very little, about 10%. This one is about 1%. It's a range, 10 or below, the lipid layer. So that is just the structure of the tear film to show you how these layers are arranged. So the innermost is the mucin layer, you can see there in green. And then the middle one is the aqueous layer. And then the outermost one is the lipid layer. So the lipid layer is the layer that ensures that your tears does not evaporate faster, while the mucin layer, the innermost layer, is the one that anchors the entire tear film on the surface of the eye, while the aqueous layer is the one that serves most functions of the eye, that is lubrication, protection, among other functions. So this is a diagram to sort of repetition of what we have already illustrated in terms of production and flow of tears. This is the lacrimal gland, as you can see. And in between the lacrimal gland and the eye, we have these projections here, which are connecting the lacrimal gland and the eye. And these projections here there are channels. And they are referred to as the excretory lacrimal ducts. Once your tears has been produced in this gland here, it will trickle through the excretory lacrimal ducts onto the surface of the eye. Then you will blink. When you blink, your tears will move towards that side and accumulate here, as illustrated by the small arrows. Once it accumulates at that point, it will get into the superior and inferior punctum. There's an opening down here and another one down here, onto which your tears will percolate and get into the superior and inferior canaliculi. These other two channels up here. Then it is from there that now your tears will move into the lacrimal sac. Then from the lacrimal sac, it will trickle down through the nasolacrimal duct into the nasal cavity. Down here is the nasal cavity, particularly in an area known as inferior meatus. inferior meatus. So it was more of a repetition to illustrate how tears are produced and how it flows down there. So we have something called tear breakup time. When tears has been produced and it's on the surface of the eye, it takes 5 to 10 seconds to break up. Anything below this, you'll get a condition we call the dry eye syndrome, which we are just about to talk about as we proceed in this presentation. So the normal breakup time for tears is 5 to 10 seconds. The normal tear production rate, the basal tears that is, the normal rate is 1 to 2 mils per day. So that is the normal rate. We can now talk about the blinking. So the normal blinking rate is actually 15 to 20 times in 1 minute. So in a normal environment or normally, a person is supposed to blink 15 to 20 times in 1 minute. Then we have factors which affect the rate of blinking, and one of them is environment here. And this one we can give example of the motorbike riders. Those people who ride motorbikes, this one here, they are exposed to strong wind, and this wind affects blinking rate, this one. And when your blinking rate reduces, then your eye gets exposed. When your eye gets exposed, you get dry eye syndrome. Dry eye syndrome. So you can see blinking rate is very important. If you blink anything less than 15 to 20, then it means your eye will be exposed to dryness and you get this dry eye syndrome. Another factor is smoke. Smoke also reduces the rate of blinking and it can affect the eye and you can get dry eye syndrome. Another thing is also attention and focus. This one is very common in the modern days, what we call the digital era. And that's why we're saying people whose profession involves long-term use of gadgets such as computers or laptops and so on and so forth, even mobile phones. If you look at your mobile phone or you use your computers or laptops for prolonged hours, or even televisions. When you stare on the television set for prolonged hours, it normally reduces the rate of blinking from 15 to 20 times per minute, as low as 5 to 7 times per minute. So this is a very drastic difference. So the normal rate is 15 to 20 times, but when you use your computers or televisions or mobile phones for prolonged hours, then the rate reduces from this normal rate to this, around 5 to 7 times. So this one exposes your eye as well, and you get dry eye syndrome. We shall see as we proceed. So the rate of blinking is very important for that matter. So what is dry eye syndrome? Dry eye syndrome. Dry eye syndrome is a multifactorial disease, and it affects the surface of the eye, and it is characterized by loss of tear film. So, as we said, the tear film plays a role on your eye, on the surface of your eye, particularly lubrication. We said functions of the tear film of the eye: we have lubrication, we have protection, we have nourishment. We can also talk of optical functions, among others. This is 1, 2, 3, and then 4. So for dry eye syndrome, our focus is on this one here. Number 1, lubrication. So on the surface of your eye, if we have any factor that will interfere with your tear film, then you will get the dry eye syndrome. Either when you reduce your blinking, or when you actually reduce the tear breakup time, then you will get the dry eye syndrome. And what we are saying is that on the aqueous, one of the key types here is that we have the aqueous deficient. This is the case where our lacrimal gland will fail to produce enough watery tears. So if our lacrimal gland fails to produce enough tears, particularly the aqueous layer, then you get dry eye syndrome. Another issue is to do with the evaporation. And evaporation is basically tear breakup time. Tear breakup time. So if you reduce your tear breakup time, then the rate of evaporation is high. Then your eye will be exposed again. Then you can get the dry syndrome, the eye dry syndrome. Sometimes you can have a combination of the two. This one and this one here, what we call the mixed. Meaning there's deficiency in production of aqueous layer of the tear film. Then there's also increased evaporation due to reduced tear breakup time. So those are the types of the dry eye syndrome. So what are the clinical features and symptoms? The patient will feel sensory discomfort. When your eye is dry, you will feel some sensation of dryness, burning sensation, stinking, or you will feel there is some foreign body onto your eye, what we call sandy, gritty sensation. You can also have a paradoxical tearing. Paradoxical here, it means contrary. This is a dry eye syndrome, but there is production of tearing, what we are calling the paradoxical. But the tearing that is being produced here, that's why I'm saying, although the eyes are dry, irritation often triggers the reflex tears, leading to excessive watery eyes. What is being produced here is the reflex. Remember we talked about the types of tears. So this will be the reflex tears. And reflex tears is produced because of the dryness of the eye. It is not the normal production. When you look at the types of tears, we talked of basal tears, We talked of reflex tears, and then we talked of emotional tears, emotional. So this one is what is supposed to be produced normally. But this one is due to a trigger. It can be onions, that is an example, and then it can be due to dryness. So which means this one is normally produced when there's a problem. So when you have a dry eye syndrome, this one will be produced in large quantities, and these patients will just have excessive production. Sometimes we call it epiphora. Epiphora is just a medical term for excessive tearing. This patient is having dry eye syndrome, but he is producing excessive tears, which is not normal, which is due to a trigger, and the trigger is the dryness of the eye. That is why we are referring to it as paradoxical tearing. It is contrary, it is the opposite of what is supposed to happen. But the type of tearing here is not the normal one. It's due to the reflex. It's due to the reflex that is brought about by triggers. A good example is the dryness of that eye. And then the other features, you can have visual changes. For example, you can have blurring of vision. You can also have ocular irritation. All the time you want to scratch the eye because it's dry. You can also have the eyelid fatigue as well as contact lens intolerance. So that diagram here illustrates some of the clinical presentations and symptoms of dry eye syndrome. So as you can see here, there is sandy or gritty sensation. So you feel like there is sand on the surface of the eye. The eye will appear red sometimes. You can also have episodes of blurred vision. Then you can have stinging or burning sensations on top of the eye. Then you can also have excessive tearing, what we call the paradoxical tearing. Paradoxical, what you have just explained. So you are having paradoxical tearing because it's being triggered by a reflex. This is a trigger, and these examples of these triggers is the dry eye as well as things like onions. We have already explained this. So you get excessive tearing. The word is paradoxical. The eye is dry, but you have excess tearing, and the excess tearing is not the normal one. It is due to a trigger. And the trigger in this case is the problem with the dry eye. We have treatment strategies. How do we treat this condition? One, we give what we call artificial tears. This one here. Artificial tears, they are normally prescribed to lubricate the eye. Another strategy is the eyelid hygiene and heat. In this case, you apply some warm compressions, and for about 10 minutes, it helps to release the oil from the eyelid glands. On the margins of the eye, you have eyelid glands, what we call the meibomian glands. Meibomian. Remember, this is the glands that produce the lipid layer of the tear film, Another strategy, you can do punctal plugs, whereby you insert tiny silicone probable plugs, which are inserted to block tear drainage and keep eyes moist. We have also advanced techniques whereby you do the autologous serum tears. The word is autologous. Autologous. This one means This is a sample from the self organ. In this case, serum tears is produced from your own serum. It's not produced from another person, yours. The term is autologous. So when a sample is produced from your own body or a graft to be used on the same body at another area, it's called autologous. So this is an advanced technique whereby serum produced from your own serum can be used. I mean, tears produced from your own serum can be used as a treatment strategy for that case. Can also have meibomian expression, among other techniques. This is an example of artificial tears that's available in pharmacies. This one is an Ophthalcare. So sometimes it is prescribed. It's just one of the brands. You have so many. So patients who have dry eye syndrome can be prescribed this medication. It is just an artificial tears, artificial. It's artificial tears. You prescribe that as part of the treatment strategies that we have looked at. So how do we administer? How do we administer the artificial tears? The patient is advised to tilt his head a little bit, and then you pull the lower eyelid to create a space, and then you instill the drops onto the surface of the eye in the space created down here as a result of pulling the lower eyelid. So the patient tilts the head upward a little bit, then you pull the lower eyelid, you will create a space down there, then you express the tear film to give 2 or 3 drops on that space created on that eye. And then how do we prevent, apart from the treatment techniques, how can we prevent dry eye syndrome? How can we prevent dry eye syndrome? One, it's environmental. You use a humidifier to increase indoor moisture and avoid direct airflow from fans or car heaters. We talked of the motorbike riders, We are increasing the list. Other people are also affected in that manner are those who are exposed to fans, blown fans. These fans can also be car heaters. These ones, they expose your eye to wind, and therefore it causes dry eye syndrome. So you can use humidifiers to increase indoor moisture. You can also do the screen habits. When we talk of the screen habits, this one applies to people who uses computers or mobile phones or laptops for too long. We call it the 20-20 rule. 20-20 rule. So what does this rule mean? It means that at every 20 minutes, after using your laptop continuously, after every 20 minutes, you take a break, and when you take a break, you look or you focus your eyes to an object that is 20 feet away. an object that is 20 feet away. And when you focus on that object for 20 feet away, you are focusing on that object for 20 seconds. For 20 seconds. This one allows your eyes to relax and also allow the normal production of tears as well as enhancing the normal blinking rate. So instead of staring on the television or your laptop or your computer for a long time, you are supposed to use this rule. Every 20 minutes you take a break and then you focus on an object that is 40 feet away. And you are doing that for 20 seconds. Then you come back to your computer and proceed with your work. Other protective measures include protective eyewear. You can use sunglasses or you can even use goggles. Sometimes you can do dietary adjustments whereby you increase intake of omega-3 fatty acids. And they are found in fish oil or flax seeds. These ones, they improve the quality of tears. Also, there is lifestyle. Avoid smoking and take breaks from contact lenses. So that marks the end of this presentation on the dry eye syndrome. You can subscribe to our YouTube channel. This is the YouTube handle, and then our channel is known as the Optics and Eye Health, Optics and Eye Health. So you subscribe, you can drop a question, You can also give a comment. You can also give an addition. You can give an addition to whatever that we have presented as we make the sessions more interactive as possible. Otherwise, thank you until we meet in the next presentation.